You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible when you talk about the realities of what it means to be black in this country. Watch this video here that took place in an emergency room in a hospital in America. This actually happened, y'all.
He wasn't playing basketball when he has it, and when he's going around, yeah, when he has these and he's throwing up and he's going in and out of consciousness. I literally saw him go in and out of consciousness.
He's completely awake and alert right now.
He is, but if he leaves this hospital, he's going to have another anxiety attack just like that one because he's in the same shape that he was in when he came in.
Sure, and he doesn't have Klonopin because he doesn't have his Klonopin.
That took 4 hours to get through. So what was I supposed to do?
I'm sorry, sir. You were the least sick of all the people who are here who are dying. Okay. There, so you picked your head up. Now, don't try to tell me you can't move. Come on, sit up.
I can pick my head up.
Yeah, sit up. Come on. Sit up.
Dude,
sit up. Sit up. I'm having you sit up.
I can't get up.
Kizzy, he needs to sit up, and he won't let me.
She's literally yanking my arm to get up.
I'm literally helping you up.
You're helping me? I can't get up. I can lift my arms to this extent.
You want us to wheel you to your house in the gurney?
That's not what I said.
You just lifted your head just fine.
Yes, I lifted my head and my arms up to here. After that, I cannot
put your hands on here and pull yourself up.
I cannot do that.
Yes, you can.
I cannot do it in the ambulance. I cannot do it now.
You can do it now.
I just tried to inhale, and I even told her I could not inhale.
He can't inhale. Wow. He must be dead. Are you dead, sir? I don't understand. You are breathing just fine.
This is not right because I'm telling you, when you see him, he is breathing. He has labored breathing.
He's not labored in the least. He's got an oxygen saturation that is 100%. He is breathing perfectly normally. This is not labored breathing.
So you're just saying that you just let him lay down in here and he's going to go back to normal. This pain that he has doesn't have anything to do with what's going on with him, right?
This pain that he has is because he worked out.
No, when he went to the emergency room the last time he had pain.
And what did they do for him?
They gave him fluids and they gave him something, a pill. I don't know what they gave him. Yeah.
For what?
For his pain and for the anxiety.
So you need narcotics? Is that what you need?
Oh, here we go. You need narcotics. Did I send you narcotics? I just need pain reliever and anxiety medication. Because I'm in pain and I have anxiety. And I said nothing about narcotics.
And you just told me that this was not an anxiety attack, that this was something totally different.
If I could get up off this chair, I really would. But
yeah, you really should, because this is ridiculous.
I can't, and you're not going to keep tugging. I'm full of shit.
He is.
And I'm sorry because, I came in here wanting to help you, and you're turning your story around. You're changing your story. Yes, you are. You're making all different kinds of, you're saying one thing and then you're telling me another thing, and then you go back to the first thing.
Like you.
So sometimes his.
Huh?
Like you.
So sometimes.
What? I'm not saying I'm not changing anything.
You're not?
No. I'm not saying anything different than what I've said the whole time.
Like me.
No. You have changed your story every time.
Whoa.
Yeah, that's how pissed off you've gotten me, okay?
I didn't do anything.
Yes, you did. So, put an IV in him, give him a liter of fluid, and we'll get him out of here.
All right, folks. Now, the video you just saw is actually 3 years old. This took place in 2018. Dr. Beth Keegstra was working at a hospital in El Camino, California. And so she was suspended as a result of this. But this has been circulating on social media, and it's illustrative of the reality of what black people face even in medicine. Dr. Dan Fagbuyi is a Pediatric Emergency Medicine Specialist. He joins us right now. Doc, glad to have you. And again, even though this is 3 years old, you heard us just talking about what happened with opioid crisis. Black people were told, go take Tylenol, go take Advil, when white folks were given more powerful painkillers because white doctors were thinking, oh, they trying to come here and get high. And so racism was in the play. So when you hear Senator Tim Scott and you hear all these white conservatives run around and say, oh, there's no systemic racism, there is systemic racism in the health field, the law field, the engineering field, the architecture field. We can go on and on and on. It's in the DNA of America, and it has dire consequences in health.
Correct. Well said. I mean, thanks for having me, Roland. It is an example of bad, poor, ridiculous bedside manner. That's just one. Let's call that what it is. Racism exists everywhere. I mean, yours truly also. I mean, these are some of the reasons a good number of us medical professionals, Black medical professionals, have left academia. We want to call it what it is. But this is an assumption. We see this with a lot of patients who come in with sickle cell into the emergency department. And they come in with complaints of pain. And the assumption is that maybe they're drug seeking. And that is not to say that there aren't some patients that do. But you have to give the patient the benefit of the doubt and not make assumptions. And this patient was definitely, clearly berated. This is not bedside manner. This is not the way we practice medicine. Fortunately, not at some of the institutions I've been have I seen any of my colleagues do such things, colleagues who are not white or colleagues who are Black. Regardless, no patient should go through that. But then even more so, we shouldn't sweep this type of racism under the rug.
Now, look at this headline here. Beyonce, guys, go to my computer. Beyonce, Serena Williams open up about potentially fatal childbirths, a problem especially for Black mothers. That is happening right now. The large number of Black women who are dying in childbirth, the medical community needs to explain this because that's just not natural.
No, it's not. And that's another sad story. Another in the laundry list of things that are wrong with the system. And until we start to address the core of the system and we point our own fingers to our own selves where we do that examination, what is it about the system? They even showed literally Black babies born to Black doctors who took care of them actually do better. I mean, these are recent data that was recently published. So we have seen this information. We know this information. It's just sometimes gone silent because, especially as you're a trainee going through the process for the young medical students and the residents going through training programs where they experience all this, they really have to sit in with the system to try and suck it up so they're not looked at as a weakling. They have to be 2, maybe even 10 times as greater as their other counterpart to even be able to present themselves in that way. We all have tried to address those issues, but it's a difficult fight. The system also has to be dismantled, and it's not just the medical profession, as you mentioned.
Julian, your question for the doc here. I mean, this is, again, why shows like this matter, Julian, because if we're not driving these questions, if we're not raising these issues, let's just be real clear. It ain't going to come up on CNN, MSNBC, Fox News, ABC, NBC, CBS on a regular basis.
You know, I appreciate what the doctor has said, and I also think we need to think about, there was a study, which I'm sure he's familiar with, it was done about 20 years ago, but by the Institutes of Medicine, and they found that a Black man going to an emergency room with a broken bone, hear me, with a broken bone, was half as likely to get a painkiller with a broken bone than a white man. And this is a very old study, but I think if we updated it to today, that would not be any different, given what's been said about opioid use. The fact is that racism is part of the cake that we baked when we made America. And you can't unbake the cake, but you can turn it into crumbs and start over. And so when we look at this in medicine, we also have to look at the paucity of African-American physicians and nurses. We have to look at the underfunding of Meharry Medical College, of Morehouse College of Medicine, at Howard University Medical School. We have to look at the many ways that Black folks are basically denied access, often don't have the assets, and then they are, I call the 3 A's, access, assets, and attitudes. And they are confronted the attitudes that come from physicians and others, health professionals, who are simply full of bias. So when they see a Serena Williams, they don't see Serena, they see a Black woman. They see Beyonce, they see a Black woman. You know, I've had interesting instances that I won't share, where, you know, once I was asked, did I have my welfare card? Moi, a welfare card. I'm like, really? Start to knock that woman in the next week. But fortunately, I kept my temper. But
Doc,
I mean,
No. Doc, go ahead.
no, I'm just saying that
Oh, Doc Fagbuyi, go ahead. Doc, go ahead.
The biases that they're in are just baked in, and we're fortunate to have brothers like this and so many others, the National Medical Association, others, really frontally fighting this.
Doc Fagbuyi.
Yeah, so I mean, so you hit the nail on the head. It's exactly what we deal with, and I do think the percentage of Black physicians, about 5% of the population, that's ridiculous, and we need to increase that number. But those biases are already planted, literally. The patient was being accused of drug seeking. He said he had anxiety. And there's some patients that fake, but that's not what we do. That's not how we practice medicine. So you definitely see the difference is clear. So how do we address that? That means the American Medical Association has to address it. That means hospital systems have to address this. That means healthcare systems have to address this. Inequities, they need to be on their boards. They need to be on their C-suite levels. They need to be promoted in terms of academia and on impact in medical school. So there are lots of reasons and funding for education to support that. Even at the high school level, as we start to funnel them into the health and allied healthcare professions. There's so many ways to start to address this, but it's not being addressed, and it's falling on deaf ears, frankly. And we've had many debates on Twitter about this, many debates in articles. You remember the racist comments that were made recently. If you're not familiar, please, it's all out there. So it's a struggle. We're constantly dealing with it, but it's not just us. It's everybody, and America has the time to make some changes, and hopefully that'll happen soon. I'm hoping.
All right, Dr. Dan Fagbuyi, I appreciate it. Thanks a lot. We'll thank you for your insight. All right, folks, back to our Roland Martin Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have, you can bring to Roland Martin Unfiltered to support it. Please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.